it's being metabolized, by which enzymes and which transporters and everything. And then we do a section of how curcuma affects, in this case, omeprazole metabolism. First of all, how curcumin or curcuma affects the whole metabolism, drug metabolism as a general, and then specifically each one of the enzymes that omeprazole is being metabolized by, how curcumin or curcuma affects it. Each one has a different data. As you can see, I can scroll down. And as you have probably noticed in the results, and same here, we use the traffic light scheme to be sure. I can put it in the details. So here, a red one says that there's a definite data about curcuma affecting this enzyme, the red enzymes. The yellow ones, it's like partial data or just in vitro animal studies that we're not sure. And the green ones are, again, clinical data that shows there is no effect on the enzyme. One more thing, in this interaction screen, you can see the level of evidence. You can see the breakdown of all the articles and all the studies that are being represented in this interaction, the pharmacokinetic and the pharmacodynamic. We also have different alerts. In this case, it's just salicylat because turmeric has salicylat, so people that are allergic or sensitive to salicylat should avoid turmeric. But we've got a lot of more alerts like neurotherapeutic index drugs or photosensitivity, composite family, and so on and so forth. I'll go back to the search for a second because I saw the recording just started. So maybe I'll kind of recap again. I hope this doesn't bother many of you. So I'll yes.
No, that's great. It would be good to go over that just one more time pretty quick. Thanks.
Yeah. So I'll start over just to make sure we got everything on video. And I wanted to show you something before, show it now. What we do also within the system, we have all the chemotherapeutic protocols already populated, already in the system. So if I just type in chemo, I will see all the chemo protocols alphabetically ordered. Okay, we've got many chemo protocols. So if I just take either one of them, let's say, I don't know, CHOP, okay, or R-CHOP. So I'll take that one. And what it does, it just populates all the drugs that actually combine this protocol and give them all in one click. So I don't have to type each and every one of them. That also prevents any kind of mistakes about this protocol. Again, I'll just show it to do again. I can type in chemo or I can type in protocol. Same thing. Let's type in protocol. So, and I got all the chemo protocols right here. Let's take another one. Let's take ACT with docetaxel, doxorubicin, and cyclophosphamide. So I can start from here. I do have to say that many of the chemo protocols have already drug-drug interactions when they are not inside the protocol. We have them here. Okay, we put them aside. You can always opt in to see them. Let's do that for a second. I'll opt in to see them, and I'll see these interactions. Basically, there are many avoid interaction between different chemotherapeutics, but again, this is unless they're in a combination therapy. So that's why if they are indeed as part of the protocol, we just hide them here. You can always opt in to see them, but we don't want to see too many of them as this is the protocol. So let's start with this, and now I'm going to add some herbs and supplements. I'll do again Panax ginseng. Let's do omega-3. Let's do vitamin C. And let's do maybe another problematic herb. Let's do Scutellaria. Scutellaria bacalensis is a herb that has many pharmacokinetic properties, so it's a problem with a lot of drugs. So here, as you see, the results populate automatically for all the interactions that I have. They are ordered again, worst to the best by default. I can sort them out, but I leave it like this. Let's go into one of them and see how an interaction page looks. So basically what we have here, first of all, we have the summary of all the evidence. You can see that this interaction is actually based on pharmacokinetics. Again, as I said before, we don't have it here because it's a pharmacokinetic, so we don't have the review of studies. Everything is here, basically. In the pharmacokinetic section, we analyze the drug metabolism for each drug, how it's being metabolized, by which enzymes, transporters, carrier, and so on, and how the herb, in this case, Cutularia bacalensis, affects these enzymes, what we got data on, because there's usually not data for all of the enzymes. And you can see here, we got different data for each enzyme. And we use, again, the traffic light scheme just to be very clear about the results we see. What is the red is actually if the herb affects the enzyme. Green is if the herb is not affecting the enzyme. And the yellow is if we don't have a decisive data or it's just in vitro animal studies. So we don't really know. So we put it at yellow. But again, you can find all the data here. For each interaction page, you also have, as I said before, all the breakdown of the type of studies. In this case, you see only a few clinicals and a lot of preclinical studies. And we do have alerts for each drug or herb. In this case, it's about G6PD and neurotherapeutic. Both of them belong to docs who will be seen. Let's go back. Let's look at another one. I will look at maybe something better. Let's look at Panax and docetaxel. That's some more data. If I stand here, you see I've got some clinical trials, both in the pharmacodynamic and the pharmacokinetic section. And again, the summary, we only write the summary after we review each and every study on its own. We make our own abstract for each study to get all the fine details, the dosages, the p-values, to know exactly what happened so we can make an informed summary. And again, the references are, they lead you exactly straight to the trial itself on PubMed, so you can go and check it out for yourself. One more thing, if I'm going to stay here, I can see it also in the previous page, but I'll show it from here. For each drug or herb, I can press the drug or the herb or the material and go to a full monograph of the herb, of the drug, this case, Panax ginseng. So you see all the different categories, pregnancy, overdosage, adverse reactions. Panax had some adverse reactions. So everything, again, reference, everything is evidence-based with references exactly to the studies to see everything you need to know about the herb. Same goes, by the way, for the drug. If you're not sure, you can go and see the monograph of the drug, whatever you want to know about the pharmacodynamics, the metabolism, contraindications, adverse reactions, and whatnot. So I'll go back to the search page. By the way, here also I do the same here. If I press any of the materials, I can go to the drug info and go straight to the monograph for each of the materials. So this is the first screen of the results that we get from all the materials that are gathered for this patient. But as I said before, this is not the only screen I want to look at. I want to look at the what to monitor screen. The what to monitor gives me a few kinds of data. First, it shows me nutrient depletions for every drug, whatever every nutrient it depletes. Red is if we know for sure that the depletion actually exists, and the yellow one is if the data is inconsistent and we're not sure. So this will say may lead, and Conzi will say leads. For each one, I can press, I can get more data, I can go to the interaction data, I can see the deficiency symptoms, and this helps me decide what I want to do with nutrients, what I want to check out more. Let me put some more drugs here, or some more herbs here, just to get some more results. So we said before that inside each interaction, I'll show it here for a second. If I go to any interaction, we do a what to monitor section where we write what tests or what symptoms should be looked out when you combine this herb with this drug. In this case, there is not much. Let's find something more problematic that will have some what to monitor in it. So let's do turmeric and docetaxel. And here you can see the what to monitor, blood drug level, and some hepatic enzymes and symptoms. specific for this combination. And again, in this what to monitor screen, you can see all of these parameters aggregated together. So you can see all the lab tests, all the symptoms. This gives me some kind of like a checkup list to do with the patient, to ask him just to be sure that everything is going well. Okay, so this is that. One more thing I want to show is the optimizers. Because our system, because we have a lot of data and some interactions are actually positive. So what we do is we make this positive jump out. So if I go to the optimizers, I can see a screen with all the drugs that the patient is taking. Let's put another one just to make it a little bit more complicated. Let's do metformin. So here I see all the optimizers, all the good herbs or supplements that can be combined with these drugs. So if I open each one of them, so I see for metformin, there's a lot of herbs and supplements that I can actually do with metformin. Let's just open the first one. I see vitamin D, and it will also show me how vitamin D interacts with all the other drugs that the patient is taking. Again, let's open another one. Here you can see how coenzyme Q10 interacts with doxorubicin, with metformin, and with cyclophosphamide. I'll show it again for chemotherapy. Let's do for cyclophosphamide. So again, for vitamin D, it shows me how it interacts. And each one of them, by the way, I can go and see the full data. If I press on it, I will go to the interaction, to the full data of the interaction. I'll go back. And if I like something and I want to add this, let's say gingerbread, I want to add this to my patient. So I just press the plus as I did. And gingerbread adds here. Let's do it for another one. Let's do it for matricaria, for chamomile. So I see if I want to add it to the patient, I just press the plus, and the herb will add up to the search results. So this is a very good way for me to check out other options that I haven't thought about, or things that have skipped my attention that I might be wanting to give to the patient. The next thing I want to show, which I think is really, really important, is how to save the search and how to utilize this save search. So basically, to save it, I can save it here, or I can save it on the icon here. I'll check this one, and let's call it SIO demo. And I'll save it. And basically, it's saved in my account. This is my account here under my name. So if I open my name, I will see all my saved searches. I will press that, and I will see basically all my patients here. The last one will be the SIO demo, which we just added. So first of all, this gives me a shortcut. If I just want to see some patient, I can just press it, click it, and I'll see whatever he's taking right away. And more importantly, we use this patient list to actually update you on any kind of new information, because new data keeps on coming all the time. We've got hundreds of trials happening every month and being published every month with a lot of new data. And what we do when we have new data and we update an interaction, the system automatically shows you there's an updated thing. So I'll go through here, let's see, okay? And I see for this patient, there's a new interaction. I can see the recommendation. Let's see if we got something else. Yeah, here I have, for another patient, updated information. I can see some text that has been changed. I can see the level of evidence has been changed. If there are new references, I will also see the numbers of reference change, if a recommendation has been changed. So basically, this is a great feature because you as a practitioner, you don't need to do anything in order to get the updates for your patients. It just jumps at you. So we think that's a huge time saver, and just takes it off your head to keep searching for new data constantly. Okay, let's go back to the SIO demo, to our patient. If there are any questions, by the way, please feel invited to start asking them in the Q&A section. I see there's also a few in the chat. By the way, my search results, I can share them. I can share them directly via mail. So if I'll check Gmail. So I'll just share it. It automatically opens my Gmail. Already with the text inside, already with the link to the interaction, and I can just send it to my patients or to another doctor. And even if the other patient or the doctor is not subscribe, this link will actually activate a token that will allow this person to see all the results for a full week. So I can share it with my colleagues or with my patients. I can also print it. I will not print it, but do it. I will select all and just do another print, but save as a PDF. I will show you that. Okay, there it goes. So let's open that, and this will show me all the materials that have been searched and all the results we have. Okay, even if we have a double one, it will show you. Maybe I'll show one. This a lot of results. Could put in a lot of drugs and supplements. So this is another way to keep the information or share the information. Very convenient as we see it. You can also, by the way, upload it to an Excel or upload a list of drugs from an Excel. If you're using a specific API, we can integrate into this API, but that's like on a custom suggestion. Basically, that's it. That's how a system works. Again, if there's any questions, Blake, if you would like to say something.
No, thank you so much. You provided a really comprehensive overview of a really powerful potential tool for clinicians to use. I know that I have a few questions that cropped up as you were speaking, but I'm going to be monitoring the Q&A for anyone. As you have questions that do come up, please feel free to use the Q&A box. And we have one that did actually just come in, Gil. What is the criteria for the recommendation? And I'm guessing this is a recommendation for caution. So can you hover over that info?
Yeah. So what I'll do, I'll just hover over that. Before I do the recommendation, let's look first of all at the level of evidence. So basically, all the drug-drug interactions that come from drug bank are either from a drug label or from research. They don't divide the research into smaller parts. We actually look at everything we have is from research. It's not from drug labels because it's supplements and herbs, of course. So as you can see, we have this ladder of how we look at not only the quantity of trials, but the quality of trials. Are they preclinical? Are they clinical? Is there one clinical or more than that? And the recommendation is very dependent on the quality and the quantity of the trials. So I'll hover that on the recommendations and show it. So first of all, I would say that we are cautious. If there's a doubt, there's no doubt in our mind. If there's a doubt, we will say there is caution and we should be alarming and of course what we should be cautious about. When we say the positive interactions, which is like these three over here, co-administration is possible or possible and advised, it's only if we have multiple clinical trials showing that. We will not give a possible combination or even advised combination if there's not multiple clinical trials showing that this combination is both safe and efficient and helps the patients either by lowering adverse effects of drugs or either by improving the clinical outcomes, which is the most important thing. Only if we have multiple clinical trials, we will use these kind of recommendations. Yeah, because I know in other databases and platforms, these, I would call them positive interactions, basically do not exist. All you have is warnings and cautions. So yeah, if the data shows that, we think that's our duty to come out and say that. Maybe I'll give a simple example. I'll show, let's say, something that everybody will know and relate to. Let's take with metformin again and show its interaction with cinnamon. Okay, so both cinnamon and metformin are lower blood sugar, but there are, in fact, so in any other databases, you will see a warning that cautions and says, be careful when you combine these two, because this might cause hypoglycemia or some sort. But if you look at the data, you actually see I'll show it here. There's actually 21 meta-analyses, 2 systematic reviews, and 54 clinical trials examining the effect of cinnamon on blood sugar. Out of them, there's 10 clinical trials that actually there's a combination of cinnamon and metformin. Again, clinical trials. In all these clinical trials have shown not only safe but efficient outcomes and better outcomes than metformin alone. So in our way, there's no other way to look at it but say, okay, this combination is actually good for the patient. So yeah, I know that differs us from other platforms, but we actually take pride in that.
Thank you so much. I'll continue to monitor the Q&A for other questions, but one question just about function that came up for me is, we're going to, as clinicians, have people who are regularly coming in, and we want to, avoid a nutrient depletion, or we're going to be regularly prescribing them a certain protocol or combination of products. When you save that kind of search, a protocol that may be specific to your clinic, when that goes into your profile, does it then also pop up in the search bar on the left? Does that make sense?
Yeah, I'm not sure I got it. I got
so say that I prescribed 3 herbs,
yeah,
and I wanted to save that search.
okay.
Does that then get saved as a protocol that can be searched?
So I can do, I'll do this. Okay, I'll do, let's say Panax ginseng, and omega-3, and vitamin D, okay? And let's say I want to use this protocol for basically lots of my patients, okay? So I can save this protocol and call it, just for my sake, call it supplement protocol. Okay, and I will save it. And then basically each time I want to use it, I will go to my saved searches, and I can go here to my sub protocol and press view, and these 3 will jump up again.
Beautiful. That's great.
Okay.
That seems like a really, really functional tool for clinicians.
Yeah, but basically what I would do, I would start with the drugs the patient is taking, because drugs are basically mandatory, probably also prescribed by other doctors that I don't want to change that. So I want to start with the drugs. I'll give maybe an example. These are the top 10 prescribed drugs currently in the world. As you can see, there's lots of them already. There's some drug-drug interactions within them, but I'll just go for the what to monitor thing for a second and see all the depletions of the different drugs, and see only from that I can see there's a lot of data showing me what this imaginary patient should be given in order to just to keep the nutrients intact.
And that's kind of a tack on to the earlier question. So it sounds like the new data that are coming in from these trials and studies come in automatically into your system. Who ends up actually reviewing those and then synthesizing the evidence before they get put onto the website?
Okay, so we have a team of naturopaths and clinical pharmacists. We go over, we get alerts from PubMed. For each herb or supplement that is being uploaded to the engine, we put in an alert. So we get every month, we get all the clinical trials that have been published for vitamin D or for panic ginseng. And we go through them and we see whatever trials are actually regarding interactions. And then we look into the trial, and either we just add a reference, if the results are the same, we just add the reference to the interaction. If the results are actually suggest a new interaction or suggest a change in the data we have, so we just change it behind the scenes, and then you get the update as I've shown before with the red bell in your saved searches. So yeah, that's our team. That's a manual work as for now. I guess probably in the future will be helped by AI, but I don't think AI can do it all by itself. I think we should have always a person outlooking the AI, making sure the data is actually that. We know there's a lot of still there's a lot of mistakes being done by AI, and we don't want to do that, not in the clinical settings. Yeah.
That's beautiful. Thank you. Another question that popped up into my head just about, it's incredible that you can export these searches and the evidence that you got and send it to somebody. And you said it's a token that gets created so that they can access it for 14 days. So my question would be, if a patient comes back and they are taking, new supplements, and so we run a new search for them and want to show them the results, is that token limited just to that individual search, or can their
Yeah,
email
if you add something to the search and then share it again, it will create a new token.
Okay, so it won't limit them based on their
No. Every time you share it, it creates a token. You can share it multiple times for the same patient or for other doctors or colleagues. Each time you share, it creates a new token and makes it visible. Because even if you're not subscribed, you can see some results, but not all of them. And we want to make sure that when you share, your colleagues see whatever data you're looking at.
Yeah, that's perfect. And I know that it's not as common, but especially with some of the chemotherapy regimens, I know that one or two drugs may be just a little bit different between different regions or different countries. So do you know if were any of the standard drug regimens based on a certain area, or?
So we have this in the protocols. Let's see. So if you see the ACT, let's say here, so ACT can be done with docetaxel or could be done with paclitaxel. So it's two different chemo protocols. They're both called ACT, but they're slightly different. So we put that here for you to see. I guess let's see the BEP. Okay, BEP exactly again could be used with either one of the platines. Could be used with carboplatin, cisplatin, or oxaliplatin. So we have all these chemo protocols again, and of course you can type in the drugs, drug by drug. Chemo protocols is a cute shortcut to make it more accessible.
Perfect, thank you. I think that I've exhausted most of my questions, and I'm not seeing any that are open in the Q&A right now. I would love to turn over the screen to Jody, if possible, to guide us through accessing the SIO member profile and then getting into EfficaSafe.
Okay, cool. So I'll stop sharing, Jody, so you can share and show it.
Perfect.
Sure.
Cool.
All right. So when you go to integrativeonc.org, if you are an SIO member, you would click here and you would log in. Once you log in, this is what you see. And if you click on this member dashboard, this is what you will see. On this member menu to the right, you can click Access EfficaSafe. No need for any special login or password. Automatically, you are taken there. So that is one of the genius things about this SIO benefit. If for some reason you're having trouble accessing your account, I'm going to put into the chat. You could email info@integrativeonc.org and tell us where you're having difficulty at which step, and we will try and help you. Please be patient with us. There are only a couple of us answering this particular email address, and we have a lot of inquiries, but we would be very glad to help you. We are so proud to be able to offer this to our members.
Thank you so much, Jody. And then I think that we have, it looks like the last question that we may have is there any warning that or disclaimer that is on the EfficaSafe website if there might be insufficient evidence available regarding an interaction?
Yes. First of all, I'll share my screen again. Let's show something. So I'll use this search with the 10 most sold drugs, and I'll put in some. Let's put licorice, and let's put let's think something interesting. Let's just take ginger. So there's probably not data for licorice or gingerbread with all of these drugs. So we'll see that down here in a note, okay? And we'll see there's not enough data for licorice and levothyroxine and gabapentin, and for ginger with the same ones, levothyroxine or gabapentin. So if we don't have any data, we do say that just for you to be sure that you're not missing anything, that you're not doing anything. Oh, there is something else I want to show. Let's take from Angelica. We do have Dong Wai, Angelica sinensis in the database already, but we don't have yet Angelica archangelica. So if I take a supplement or herb that is not yet in the database, I can see that the eye here is yellow instead of blue. And if I press it, it will tell me that this material is still under construction. We do follow up on things that people search, and we do our priority as people search. I mean, the most searched herbs that are not yet, they get a high priority, and we'll get to them first. So we do monitor that, and it does say to you that this herbal supplement is still not in the system. So don't count on the results regarding this one. It is important to say for sure. Yeah. Maybe I'll show just one more thing just to make it nicer. So let's do Angelica, the sinensis one, Dangui, and I'll do it with aspirin. And I'll just show that sometimes an interaction is not a clear-cut thing. It depends on the target the drug is used for with the patients. So here we have actually 3 different interactions, okay? And the interaction depends on what you use. So if you use aspirin as an anti-migraine here and there, it's not contraindicated. Or if you use it as an NSAID, but if you use it regularly as an antiplatelet, then caution should be taken. And of course, for each one, there's a full data on that saying why this recommendation or another recommendation. But this might be the case sometimes that it's not a clear-cut thing, and it depends on the actual use of the drug. Yeah, that's I'm happy I got to show that.
Well, thank you so much. I do anticipate that some questions might come in later on through email, so we can always reach out to you in case any more Q&A comes up. Looks like we might be ending just about 15 minutes early, unless there are any final Q&A questions that come up, or if, Gil, you have any final thoughts or comments.
I just want to say that we're in the team. We're very proud to serve the SIO members. As most of us have been practicing natural medicine with cancer patients, we think there's a lot of value and a lot of benefit that can be derived from using our database. And we are very just proud and honored to help. That's what we do as practitioners, as doctors, as pharmacists. We want to help people, and that's the way we can help them the most. That's what we feel. So thank you, everybody, for using it. That's making us feel alive and vibrant.
Well, thank you so much for dedicating your time. And we do have someone who just commented in. It's so great to have this benefit, and they'll be sharing this information with their own clinicians. We do so appreciate, again, your time in EfficaSafe for offering up what you do to the SIO. And then I think that we can all say on behalf of patients and their safety as well, we thank you for that too. Thank you so much for our attendees as well for spending your time with us today. As we have in the chat, the webinar will be available for viewing on the SIO YouTube channel by next week. So thank you all very much, and I hope you have a good rest of your day.
Thank you, Blake. Thank you, Jody. Thank everyone for joining us.
Thank you.